you. Now, sodium valproate is a powerful drug that's been prescribed for decades to people with epilepsy and bipolar disorder. But if taken during pregnancy, the drug, known as Epilim, carries a 10% risk of physical abnormalities in unborn babies and a 40% chance of autism and learning disabilities. That's why women of childbearing age aren't meant to be prescribed it unless there's absolutely no alternative. But a survey shown exclusively to BBC News suggests that nearly 70% of women did not receive the safety warnings. Now, about 20,000 children have been harmed by valproate medicines in the UK since the 1970s. The medicines regulator said the drug had been kept under constant review. Well, with me now is Deborah Mann. She took the drug whilst trying to conceive and had several miscarriages and stillbirths. Both her daughters have been affected by the drug. Deborah's 22-year-old daughter, Bronwyn Mann, is also with us, and Claire Pelham is the Chief Executive of the Epilepsy Society. Thank you all so much for coming in. I want to start by talking to you, Deborah. It sounds like you've had a horrific experience.
Yeah, I was overdosed on sodium valproate. I was taking 5,000 milligrams during pregnancy. This is a huge overdose. I think it's 800 milligrams, they're saying, at the moment is the ceiling. So I've been told it's more or less no surprise that I have disabled children. In fact, they're incredibly lucky. I have lost 3 previously, and this is probably why.
Did you have any warning at all? Any conversation with a medical professional?
After I lost one of my children, I asked if it was to do with the medicine. The only thing I was told was, oh yes, it'll be only about 8%. It won't happen to you. Yeah, and yeah. It's a different story, it's not true, yeah.
Bronwyn, I want to bring you in because your life has been hugely affected by the drug that your mum took.
Yeah, when I was little, I seemed to be perfectly normal, but I used to wear splints, well I still do, I wear splints every day. I used to get pulled out of primary school, literally just in the middle of class, they'd pull me out and say, you need to do your exercises, but now my health has gotten so much worse. I'm in chronic pain, I get migraines, I have many issues with my brain. I've been told I could die anytime, I could become blind, I could have a stroke. It's just so many mixed signals, I just don't know what's going on.
How do you live with that?
I don't know, I really have no idea. I'm one of the people who believe in the saying you only live once, and I literally live every day as it comes. And to be honest, what I'm doing now is I'm just helping a charity get the message out.
Which you're doing today, which is just so important. For you, Deborah, how hard is it for you to look at your children? As a mum, we feel guilty about so many things anyway, don't we? But how hard is it for you?
I've lost 3 children, so for me, these are so special. Some people sort of say to me, you're too huggy as a family and so forth. But for me, this is as it should be. We love each other, and I tell them that all the time because at the end of the day, they're special. And as I've been told, as I said, we've been told that they shouldn't have happened, so they are.
Oh, I can see that. I can see that bond as you sit here now, and the grins between you. Claire, how common are these stories that we're hearing here?
They're worryingly common. So the first thing to say is this isn't a small issue. Last year, 28,000 women who were of childbearing age were prescribed this drug. And the survey that we conducted this month jointly with Young Epilepsy and Epilepsy Action showed that 20% of the women currently taking this drug who responded had no clue that it could cause disabilities to an unborn baby. And the same number had never had a conversation with a healthcare professional about the risks. I mean, that's a truly worrying statistic. And the reason that we're here today is that we think that the time for voluntary guidelines, suggestions, hints, and so on is well past. This drug has been prescribed in the UK since 1974. It's about time it was made mandatory by the NHS for the women who are taking this drug to have a conversation with a healthcare professional at least once a year. And there's one man who can make this happen, and his name is Jeremy Hunt. It's not about money. It's not at all about money. It's about the willpower to do something about it, to give some leadership to the system.
Anybody who's on long-term medication, when they go to their doctor, would expect to have a conversation. Even if you go on a course of short-term medicine, you will be told what the side effects would be, what the risks could be. So is it clear why these conversations aren't taking place?
We think, and it's hard to be sure, it's certainly hard to be sure, but what we think is it's two things. Doctors are overwhelmed, they're very busy, and they focus on why it's terribly understandable that they would focus on what's compulsory. And this isn't compulsory, it's a suggestion, so it falls down the list. And the other thing that we think, sadly, is that epilepsy is a Cinderella condition. There's still a great deal of stigma. Many people with epilepsy don't talk about it, they don't tell their closest friends, they don't tell their work colleagues. And so it's not top of mind in the same way that other conditions are. So that's why we're here today, to make people more aware of the significance of this condition and the 450 babies who are born every year to women taking this drug.
You agree with the stigma?
Yeah, yes, very much so. I come from an older age, obviously, and in those days I was automatically put in a class for people with learning disabilities because I had epilepsy. I've learnt only very recently I'm actually not that in that bracket, but I've lived my life as if I have been, which is, it happens very common in the support group I volunteer for, Oaks Charity. We see this all the time. There are so many women that are undermined. Their abilities are undermined and they don't achieve their potential.
And what's that, just down to lack of information about the disease, a lack of understanding?
People are frightened by it. You have women who are having, I've had seizures outside and people will either crowd around you and stare or they will leave. And you will get people that help, but then they overhelp. You're supposed to leave a person, move through the seizure process. This doesn't happen. So people are just frightened of it.
So what needs to be done now? I mean, are you talking to doctors? You obviously mentioned that you want Jeremy Hunt to bring this in, but is there a way to speak to doctors, to try and get doctors, for example, to say, as you say, every year when you get a repeat prescription, you need to go and have a consultation?
That's exactly what should happen. And good doctors do that. But we're worried about the 20%, the missing 20%. So last year, the Medicines Regulatory Agency introduced a really good range of information tools to be made available to support those discussions with a doctor, a nurse, or even your pharmacist. But our survey showed that 68% of those who were taking the drug had never seen or heard of it. So it's just not reaching the people it needs to reach.
I've spoken to my GP. They received their toolkit 5 weeks ago. My local pharmacists that I've spoken to haven't seen it at all, and they're all supposed to be giving it out. I mean, this came out, as she said, last year, and it's not being done.
Are there other drugs? I'm just thinking, if you get prescribed this medicine when you're a teenager, for example, and then you become a woman of childbearing age who wants to have children, is there an alternative safe drug that those women can be placed upon?
And that's why it's really important that you have the discussion with your own doctor. For many people, the answer to that question is yes, but for a few people, it will be a very difficult decision, and you need to walk through the risks involved to you of stopping the medication and to the potential risk to an unborn baby. It has to be a personal, detailed, tailored discussion.
Deborah, are you angry?
Yes, but you sit on that. I mean, at the end of the day, you have to get on with your life. Your children need you. You just have to get on. So you sit on that because there's no address. I was involved in that very first, when they did the compensation thing a number of years ago. I was involved in that. When that fell through, it has never been picked up since. So what do? You just have to get on with your life and realise maybe is a chance for compensation if Jeremy Hunt moves forward and gets off his bottom. But yeah, we're just carrying on. But what's the worst thing is dealing with the issues that the children face. We are seeing children change and develop the syndrome. Sometimes, like Branwyn, it hasn't been picked up because doctors are not looking at people properly. Then when they hit teenage years, you've got all other things kick in because the chemical processes have come in, and then as they grow older we're seeing other changes, developmental changes within them, neurodevelopment, and we are very concerned. As Oaks Charities leading support group for FACS, we see these things all the time.
And for you, Branwen, do you get angry with the situation?
To be honest, it's more shock than anger, because I've met so many young people with fetal valproate syndrome, and it's just shocking what they're going through. I mean, one of the things I've met this family that I've known for quite a while, and this woman, she has a daughter who has severe spina bifida, and I think that she's classed as one of the most severe cases that we've seen.
So it's just heartbreaking to see all these families that have been affected, and yours included. So listen, thank you so much for coming in. I'm so grateful to you.